Hi everyone, Dr. Anjana Bana here, and welcome back to another Spill the Tea with Dr. B. We are here at the really cool June's Coffee Gallery Bar. No, June's Coffee Bar Gallery. That's what it's called, right? That's what it's called. But I love this place. It's super funky, and the coolest thing is you can come through, have your coffee. They've got some yummy food, and you can grab some paper and paint. They've got like all these watercolors and acrylics. I think they even have oil paint. I'm not too sure, but you can sit down and just relax here for a good part of the day, and that's why I like coming here. But I am here to talk about something important, as always, spill the tea on some of my favorite things, aesthetic medicine, aesthetic treatments, dermal fillers. So we are fresh off our AMCSA Congress. This year it really did a I don't want to say on camera, mind blast with us. If you can just imagine what it did to the doctors, we were just left stunned afterwards. And you know, it's a lot of experienced doctors that go, and then we well versed with polynucleotides and exosomes and this filler, that filler. But you know, there were so many different opinions this year. It blew our mind. And in South Africa, competitive advertising is something that's not really allowed. Like, you can't say Coke is better than Pepsi, you know. So it's like, in terms of like the culture here, it's not something we're used to. But a lot of the doctors, especially from Europe, overseas, were very like, you know, this product is not as good as mine, this one does this, you know, bad mouthing. So we had to really keep our head in the game, think critically, and think about what we know, what the studies say, what we've done in practice, and apply that for, you know, the best results for our patients. So you don't have to sort through the marketing, and patients also have to do that. Is we have to sort through marketing jargon and nonsense, and so do you. So I'm gonna go through one of my faves. This is calcium hydroxyapatite. There's a hybrid and there's a pure one, or one of my colleagues from the UK calls it kaha. So calcium hydroxyapatite is such a long word to say, and you know, we can't really keep on saying the brand names, you know, just out there. It's one of the things that's restricted in our country. So I'm going to be calling this kaha and the hybrid kaha. So hybrid kaha is joined up with hyaluronic acid, so that's the difference. And I did a talk on it, and how amazing this is as a biostimulator, and the amazing and safe way that it's been used. Well, this one in particular for over 20 years. So it's been FDA approved for lipodystrophy. So that's where like excessive fat loss in your face. FDA approved for filling the hands, as well as wrinkles. And in the biostimulator space, it's actually, so the FDA approval is more as a pure filler like this, but the off-label uses of it is more the biostimulator uses. It's where this can actually be diluted with saline, with some lidocaine, and can be used as a wash. It can be used as a wash in your neck. They use it for buttock enhancement, for loose flabby arms. They use it for cellulite and stretch marks. It's exceptionally versatile. So the important thing with this, and what inspired this video is actually a shout out to Dr. Manoka. She's one of my aesthetic besties. So she messaged me yesterday and she's like, listen Anj, why don't you use this stuff? She's a big user of this one. And I said, listen Manoka, I actually do. I just don't, you know, I don't often post that, but I actually use a lot of this stuff. It is exceptionally lifting, exceptionally hydrating, great for patients that are gaunt, because 3 months later you get a surprise with the HA like plumpness. So I do actually use this. And she was asking the reasons why. You know, a lot of people may be reluctant to use either of these. One of the reasons is kaha is not, you can't dissolve it. You can't dissolve it with hyaluronic acid, but if the proper technique is used, cannula, the amounts that I use are, you know, it's like low risk for vascular occlusion. I wouldn't say no risk, but very much low risk. This one has 70% hyaluronic acid in it, so pretty much dissolvable. as well. This has been around for a while, but this has only been around like in the world for about 5 years, and in our country maybe a year and a half. So I understand the reluctance, and also the indications, like the areas it's indicated is here, and then like along the jawline. So just like kind of to do, I know people, they call it what, the 3-finger facelift, like, you know, to kind of do this. It's not going to give you a facelift, but it is exceptionally lifting. I know my colleague uses it in hands and necks and things like that, but it's not indicated for those areas, and it hasn't been around enough to be studied there, but she's safely used it. This, however, has been used extensively all over the body. So if I use them in combination or in the same patient in different sessions, I often use this as a foundation first, and then I would use this in the rest of the face, or I'll just use this. But yes, there's nothing wrong with either. Another thing she brought up, and it's a rumor, so you know, talking about this competitive advertising again, reps would come around, this is junk, and which is wrong. You know, you should rather extol the virtues of your own product versus saying this is dangerous, this is junk. So they say this stuff creates bone, so almost impossible, even if it is put on the supraperiosteal area, supraperiosteal on the bone. There's no osteoblasts there. There are no cells that make the bone. Some oculoplastic surgeons actually scrape bone around the orbit and then they put it down so it'll stimulate the bone. But calcium hydroxyapatite spheres, it depends on the size. So these are small, perfectly round spheres, 25 to 45 microns, and they're more for collagen production, angiogenesis, which is blood vessel production, elastin, hyaluronic acid. They decrease, they increase fibroblast contractility. So the fibroblast does this and makes more and more collagen and elastin. But if the particles are big, like really big, like 400 microns, then yes, there's been bone formation found. But you won't get it with these products. It doesn't interfere with radiographic imaging, so that's another thing that it'll block if you have something wrong with your bone. It's going to block that, so it doesn't, and that it sticks around for a long time. So they did an MRI, well, on this one, the calcium hydroxyapatite here, but I'd assume it may be the same for this, but you know, there's no studies yet. But 2.5 years MRI, all the calcium and phosphate, it breaks down into calcium and phosphate ions, were eaten up by macrophages, and they're completely gone. Another nice thing about this is how it makes the collagen. So we use a whole host of biostimulators. One is polylactic acid that uses an inflammatory response to intensely make this collagen and elastin and bring about fibroblasts there. But this here it's called mechanotransduction. So basically mechanically pulling on the fibroblasts using no inflammation to create the collagen, which is pretty cool. So nice, you know, it's like low immune reaction rate. And also another thing, this, because it hasn't been around for a while, I can't say, you know, how many, but nothing that has been reported thus far for this. But for this also zero granuloma rate. So granuloma is like basically your body's reaction to a filler. It creates a little capsule and makes a little lump, that granuloma. And so there's been 0 with this. There's been 5 with this, and say a different hyaluronic acid injected, but you can't tell, is it this, was it the hyaluronic acid? So for pure this, Kahar injections, thus far nothing. One of the big things that can happen, you know, it's not all roses. One of the big things that can happen would be nodule formation. But they often say that's also technique related. So nodules is like a collection of products. So with these sort of products, you know, try to reduce your bolus injections, you know, not lumps, just like each thread of filler injected should be at like 0.1 or less. And with this, the biggest problem in a study was nodule formation. And most of the nodules came from around and in the lips, even if when they told the participants not to inject into the lips or around the lips, but people were peopling, even doctors people in a silly way sometimes. I don't know why, but that was the biggest problem with this. But a proper technique, you wouldn't get nodule formation. If you have any questions about any of these products, or calcium hydroxyapatite or hybrid filler, I'd love to hear them. I mean, I do use them both. They're fantastic, but they're not that, you know, in our country, they're not as widely used. Drop them in the comments down below. Like, share, and subscribe. Bye.